The next goal of mental health literacy is to help people understand how and when to seek help. It often takes a lot of time for people to ask for help after symptoms of a mental health disorder begin. That is beginning to change because people are talking more about mental health, and there is less stigma. You have learned how the brain is wired to respond to challenges. Knowing about the brain, particularly the social threats, helps us understand why people hesitate to ask for help. That is why it is so important to understand how to seek help effectively and have a plan. Remember the 4 S's? The 4 S's can help you set a plan in place, just in case you know someone who needs help or if you need help. It is especially important to have a plan for emergencies. Again, our brains are wired to protect us. Sometimes, that can make it hard to act, particularly if we are put in a situation where we are worried about someone, but they have asked us to keep it a secret. We might want to do what is easiest in the short term, but getting that person help can avoid painful long-term consequences. Self-harm is one of the leading causes of death for people aged 15 to 24. This is a scary statistic to hear, but the important thing to know is that we can get help. There is a lot of misunderstanding about how to help someone who is experiencing thoughts of harming themselves. The majority of people who are thinking about self-harm give some signs about their plans, so any talk about hurting oneself should be taken seriously. Asking someone whether they are having thoughts about hurting themselves does not make them more likely to harm themselves or to develop mental health issues. In fact, it provides them with the chance to get the help that they need. If someone is thinking about harming themselves, they need immediate help,